We're broadcasting from the Middle Tennessee Electric Studios.
Visit MTE.com.
Middle Tennessee Electric, serving to make life better since 1936.
This is the WGNS Action Line, talking with Rutherford County newsmakers
since 1947.
The WGNS Action Line. Now your host, Scott Walker.
You are tuned to WGNS, your good neighbor station, on the airwaves since 1947. Well, we've all heard the cold weather, and now joining us on the air, the medical director of the Women's Clinic at Ascension St. Thomas Hart, Dr. Nishtha Sareen. Doctor, how are you this morning?
Hi, how are you doing, Scott? It's great to be here. Thank you.
We've talked about snow and ice and temperature dropping. All of that being said, what does this mean for our health and heart health especially?
Absolutely. When it comes to heart health, weather change, it can be significant in two specific ways. One is because it increases the demand. There are a lot who have not been as active throughout the year, and then we are shoveling snow suddenly, and that's a lot of exertion on the body. And the second is the fact that cold itself, the weather itself, can cause the arteries in the heart to clamp down. And that is why it decreases the supply of the blood to the heart muscle. It is called vasoconstriction. That is the medical jargon for it. All in all, the demand increases and the supply decreases. So we have to be very careful, particularly in patients who are over 50 years of age. Adults who are over 50 years of age have had heart disease, have high blood pressure, diabetes, high cholesterol, anybody who's involved with tobacco at this time, family history of heart disease, or if you have symptoms. The key is not to ignore the symptoms.
Because you are a cardiologist, what would be the dangers in going out there in that cold weather and doing stuff?
Yeah, that's a great question. And that brings us to what are the red flags? When do you stop and when do you ask for help? One is recognizing that when heart is under stress, when you have chest pain, chest pressure, shortness of breath, pain in the arm, numbness in the arm, neck, jaw, back, all those are signs, warning signs of heart attack. So if you are shoveling snow and you feel any of those, please stop and call 911. The other important aspect to consider in this case, Scott, is that women, when they are shoveling snow or doing physical activity and have a heart issue or a heart attack, are not going to have the same symptoms. They may just feel dizzy, nauseous, may have more sweating, extreme fatigue, extreme shortness of breath. All in all, if you are shoveling snow and you get any of those symptoms, please don't ignore them. It is really important to dress up warm, make sure you're covered well, understand the risks of exposing yourself to the weather, make sure the shoveling itself, you take breaks, do it in short intervals, and make sure you stay hydrated.
It sounds like for proper circulation and for good heart health, being warm and staying warm is one of those number one things you want to really try to do is stay warm, and then also just feeling for any body changes, chest feelings and stuff like that.
Absolutely. Very well said. Listen to your body. Make sure you are listening to your body. The other important thing also, Scott, when weather changes, one of the things we have to know about is that a lot of us will be inside our houses. We will not be able to do our routine outdoor activities that we are used to doing. Sometimes that can lead to being more sedentary. It can lead to gravitating towards high carbohydrate diets. The weather change itself, the cold blues, and you can get stressed. You may have more stress, experience more stress than usual. So it's really important to find how you can stay active inside the house and move your activity from outdoors to indoors. Also, make sure you have enough supply at home and you have healthy options right there to be eaten.
We just got a text message here from a listener who said they have Raynaud's syndrome, I believe it is, and they said they lose feeling in their fingers and in their toes, and in response, their fingers turn almost like a white color. But they're asking, is this any danger that could be a sign of any cardiovascular issues that could deal with my heart in the cold weather?
That is such a great question. I'm so sorry you're dealing with this. But Raynaud's does. It's a vascular problem. It's the problem of the arteries of the body, of usually the extremities. But let's remember, our body is a continuum. The arteries that are in the hands and the feet, the same quality of the endothelium supplies our heart, supplies our brain. So yes, patients who have Raynaud's, patients who have rheumatoid arthritis, patients who have lupus are all at risk of heart disease.
Lupus, that's one of those things you hear about, and often you hear about people who are diagnosed with it. But how does that tie in to the heart and cardiovascular health?
Yeah, lupus is a systemic inflammatory condition. What that means is that it usually manifests with skin symptoms, with a rash, with hair loss, mouth sores, light sensitivity, feeling fatigued, maybe fever. It's very general symptoms overall, but we have to remember that the reason you have all these symptoms is because the inflammation in the body is increased. And the same inflammation, the inflammatory cells, circulate from head to toe. So they are also circulating in the heart. And one of the important episodes when a heart attack happens, there are two things happening simultaneously. One is the inflammation or the sudden stress, and the other is underlying risk factors and cholesterol and lipid. Both of them have significant role, and patients who have lupus are at higher risk because of the increased inflammation in their body.
Inflammation in the body, never a good thing, especially for those who have arthritis. And the cold weather, how does that impact the overall inflammation within someone's body with things like arthritis? And is that causing the heart to work overtime?
That's again a great question because, yes, the problem with arthritis is that your symptoms will worsen, the stiffness will worsen, especially with the weather change. But again, in that inflamed artery, already that is inflamed at baseline, now you're exposing it to extreme cold, which can cause the arteries to clamp down. So, for instance, in patients who have Raynaud's, it could cause complete stop in circulation in the extremities of the artery. So it's really important to cover yourself and stay warm. And frankly, for us, when we have patients who are predisposed to heart attack with these symptoms, we ask them, try and not shovel and ask for help and have somebody help them out.
Again, this morning we are talking with Dr. Nishtha Sareen with Ascension St. Thomas Heart, and she is the medical director of the Women's Clinic at Ascension. And I'm curious because we hear more and more about sugar and we're hearing stories about how people should cut more sugar out of their diet because it leads to more inflammation in the body. And I'm wondering, how much truth is in that message? Does sugar really cause more problems like that?
Sugar is definitely not a friend. High sugar levels can trigger inflammation in the body, which can a lot of times manifest as people feeling more tired. It's slow wound healing as well. If you were to get an infection, it tends to heal slowly. But we know that there are different kinds of sugars. There are complex sugars, and then there are simple sugars. The simple sugars that are usually glucose does cause not only acute inflammation, that is immediate inflammation, but also it can cause chronic issues in the body and lead to something called metabolic syndrome, which can increase heart attack and stroke risk.
Man, all this talk about heart attack, are there more heart attacks during like the really hot months of summer, or are there more heart attacks during the winter months? Because I don't think I've ever heard somebody say one way or the other. I'm curious, is one worse than the other?
It's weather change extreme, which goes in either direction, is a stressor for the heart. Remember how I told Scott that there are two things that usually direct a heart attack. One is the cholesterol, the lipids, and the other important one is stress on the body. So it's all about how your body perceives that weather change. Extreme heat can lead to heat stroke, and that can cause extreme dehydration, which in itself can cause a heart attack because your body is more inflamed at this point and more stressed. But so is true in winters. It happens by a different mechanism because now it's not that you are really dehydrated. It's that the pipes that are causing the blood to go to the heart muscle are clamping down. So the mechanism is different, but the effect can be very different based upon the predisposition of the patient.
I've got to tell you, since the last time you were on the air, we got a pretty large number of texts and emails from listeners, and then the response grew even stronger after we posted that podcast on our website, which then went to iTunes, Spotify, all those other podcast platforms. But we had many listeners reach out, and they were asking, please get her on again. And next time she's on, ask her to talk more about the topic that led these people to email, message, and text us. And that was POTS, because you brought this whole POTS thing up, and it was a first. I guess a lot of people have ever heard about it. But let me read you one message, just briefly what we got. This one lady, she reached out. She said, because of that interview, I asked my doctor about POTS, which led to a diagnosis for health issues that I'd been experiencing for years, and that conversation changed everything. And she said, for the first time, I feel hopeful and like I'm finally on a path towards recovery. She said, while the road ahead of me may be a long one, I now have a map and an actual destination. So please tell Dr. Nishtha Sareen that I really appreciate it, and I would love to hear more about this topic in the future. So POTS that you brought up last time, first of all, what is that?
Well, first of all, thank you, Scott, for sharing that. It's really heartwarming to see the impact that these conversations can have. So thank you for doing this and leading this. POTS is, it's a complex syndrome that presents with a lot of symptoms that could be rapid heart rate, it is dizziness, fatigue, brain fog, and it is triggered. There's usually something that causes it to happen. Trigger could be an infection, it could be a trauma in the body. It usually starts at a very young age, 12 to 14 years of age, and the people who are affected by it, typically women, they tend to pass out. And the sad part is, really, in the medical literature, our physicians are not trained to treat POTS as well, as aggressively as other medical conditions, despite the fact that it affects a significant proportion of our patients. Now, what's staggering is that most of these women will get, so the problem is with the autonomic system, which means the problem is functional and it's not structural. And all the tests we do look at the structure of the heart, the ultrasound, the stress test, and all those tests come back normal. So a lot of these patients will have these episodes over and over again, and the heart testing keeps coming back as normal. 75% of these women get labeled as, okay, this is probably in your mind. It's anxiety. You got to make sure you take nice deep breaths. Make sure, some of them get sent to psychiatry. There are a substantial percentage who end up in mental hospitals because mental medications, the medications for anxiety and depression don't work because that's not the problem. And there is a very simple way to diagnose it. What has to be done is really generate awareness so people are aware that this is a possibility. There are medications that we give to treat it. And just like, the person who reached out to you, we have patients who have been able to work after 19, 20 years because a lot of them had to give up their dreams because they just couldn't keep up with these symptoms at work. I just want to take a moment to say I'm glad that we found the diagnosis. I'm glad you advocated for it. Thank you, Scott, for talking about it. The treatment is, of course, multifactorial. It is medications, but in addition to it, a lot of lifestyle changes, exercises, diet. There are dietary elements that can help with it. In our program, for that specific reason, we do have a nutritionist who works with our POTS patients to tell them, hey, we just don't tell them, hey, just eat large amount of salt. I try to do things myself before I ask my patients to do it. So when I started telling them eat salt tablets, I tried having one myself, and it was not a pleasant experience. So what we try to do is, what can you prepare on a daily basis or frequently over the week where you can add more salt and still enjoy the food? So interventions like that, in addition to lifestyle changes and medications, can go a long way.
I don't know if this is true, but it does seem like we're hearing more and more about problems dealing with the autonomic nervous system. And for some reason, it seems like, I don't know if healthcare providers are not fully trained on the autonomic nervous system. I don't know what it is, or if there's just not enough known about it, or if it's just such a specialty that maybe you have to go to the right specialist. But when it comes to problems dealing with that autonomic nervous system, it seems like patients experience such a wide array of symptoms dealing with or leading to diagnoses like POTS.
That's true. It's very well said. And, it's a multifactorial problem. One, are we trained in it? Because we have been so fixated on the structural issues which take precedence in most of the medical treatments we do. Two, is it because today we have more awareness about it and we are talking more about it? Three, is it because we have been affected by multiple infections like flu, like COVID? We have seen a significant increase in autonomic dysfunction since COVID. So is it the exposure that they're getting? Is it the hormones that they're getting through our foods, the processed foods that are causing it to happen? There's so much out there, Scott, that it needs attention and investment.
Do you think we're going to see more research in the near future on the nervous system in general, and that's going to lead to more cures and help?
Absolutely. There is a national, there's a revolution going on nationally right now, as you may be aware, where a lot of attention is going towards long COVID and POTS. And also, and there should be more. It's not enough, but definitely we should have more answers in the coming years.
Because it's the autonomic nervous system, and it does, like I said, seem like we're hearing more about it. What about things like complex regional pain syndrome and other things along those lines, maybe fibromyalgia? Do you think all of these things are also tied to that nervous system? And do you think there'll be help or better help available in the future for those types of patients?
Yes, I hope there is, but it's spot on there. Complex regional pain syndrome is the one where you can have pain in multiple, it's a chronic condition, and you can have pain in multiple areas of the body, which is out of proportion to what we see on testing. Now, I would like to draw the attention to one particular condition which also happens, which we don't see on testing, but patients feel, and that is vasospasm in the arteries of the heart. Now, what I'm talking about is something called variant angina or Prinzmetal angina. Presentation will be, usually at night. It's called Prinzmetal. When it happens during the day, it's called variant. It's chest pain that goes to the jaw, shoulder, arm. And, patients feel, I'm having a heart attack. It can happen with exertion, can also happen at rest, sometimes wakes them up at night. It can be associated with numbness in the arm as well. And they go to the hospital and all the testing comes back okay. There is a spasm that happens in the arteries of the heart, more common in women, which is not inconsequential because it can lead to heart attack. And some of these women will also have positive blood tests in the ER. But again, the heart catheterization as well does not show the blockage. So what I wanted to plug in there is that there is a very complex syndrome that exists, and it can also affect arteries of the heart. And what's interesting is during cold weather, it manifests more. So if you have chest pain, chest pressure, going to the jaw, shoulder, arm, and you go to the hospital and the routine testing doesn't show a problem, it is always good to ask and think, could this be vasospasm?
It's so interesting when we start talking because it seems like one condition or one symptom can lead to such a wide array of diagnosis, such a wide array of things that it could be. How hard is it? How long is this journey for a lot of people out there when they start talking about one symptom, but maybe they're going to the wrong doctor? But how hard is it to get the proper diagnosis when it comes to stuff like POTS?
The diagnosis is very variable. Again, it depends upon how quickly somebody thinks about it and tests you for it and starts treating it. The longest I've seen is around 40 years.
Wow. That's a long time to get a diagnosis and to get, I guess, the proper help.
Absolutely. I mean, and the patient I'm mentioning about, they wanted to be a nurse. They trained, but they couldn't complete the education. And when I saw her, I mean, she was in her 60s at that time. And her greatest regret was that she couldn't pursue her dreams because her symptoms limited her so much.
That is sad to hear. Now, going back to the cold weather, for those listening who may have some type of circulatory problem, may have some heart condition, again, what are some of the precautions they should take and things they should know about before going out there in the cold weather?
First, please know if you are at higher risk, you have to cover yourself really well. Make sure you are warm, you're covered well. Know that there can be direct, even if you're not working, the fact that you're there in the cold is a stressor for your heart. So please cover yourself really well. That's one. Two, stay hydrated. Make sure if you are going to be working, you do some warm-up inside the house. Just try to do some stretches, get your body ready. When you go out, one, if you can get help, but if you cannot and you have, please do a little bit of work at a time and take frequent breaks. Make sure you take breaks, you rest, you hydrate yourself. It's really important to ensure that even during this gloomy time, when you're mainly indoors, you're eating healthy, lots of vitamin C, know that you're more prone to infection, keep your immunity up, and doing a little bit of workout inside the house, whether it's 10 minutes, 15 minutes, goes a long way.
And for those who have, like this person texted in, is it Raynaud's or Raynaud's syndrome?
Raynaud's syndrome, yeah. I would say please do not expose yourself to extreme cold. Make sure you're covered really well and stay warm.
So they literally, if their fingers get whatever too cold, they may not be able to feel something like, I guess, frostbite setting in. So hand warmers and rechargeable heated gloves, would that be a good idea and would that help?
That's a brilliant idea. And a lot of our Raynaud's patients do use it and they see a lot of difference.
It seems like that would help quite a bit, but staying warm is a very big thing, and looking out for any types of pain that may be in your chest, in your back, your shoulder area, and for women, even in their jaw. For husbands and boyfriends out there, if your wife or girlfriend says, hey, I've got this weird shoulder pain, you should listen and maybe even recommend, maybe we need to go to the doctor or the hospital to check that out.
Sounds fair. I couldn't have worded it better, Scott. Of course, just to be very, very cautious that women do not have classic chest pain. It's not going to be classic. If there is a symptom, please take it seriously. Listen to your body. When
you see new patients, how often is it the spouse who maybe kind of pushed or suggested that their loved one probably should go get a little extra care or should go to the doctor to check it out? How often is it the spouse, the one who kind of pushes for your wife, let's say, to go to the doctor?
Scott, this is so interesting because a lot of times, I would say probably, tough to put a number on it, but probably 60%, 70% of the time, it is the husband who brings the wife in because the wife is they usually start their conversation by saying, women will usually start by, I think it's just in my brain. I think it's just anxiety, but he asked me to come. So the role of your companion to push this forward cannot be underestimated.
I love that because, in marriages, you always hear about how it's the husband who always refuses to go to the doctor, but yet at the same time, it's often the husband who pushes the wife to go to the doctor. I like that. That's funny.
It is funny. And, frankly, it goes the other way too, Scott. We'll have wives bringing their husbands in, and the men, they play strong. They're like, I'm fine. And then they're like, no, he has this symptom. So it's really a teamwork when it comes to heart health.
I can definitely see that. Again, with us this morning, Dr. Nishtha Sareen, and once more, she is the medical director of the Women's Clinic at Ascension St. Thomas Heart, and we've got basically a brand new, for the most part, state-of-the-heart facility right here in Murfreesboro.
That is right. And please come see us if we can take care of your symptoms.
Well, I appreciate you joining us this morning. And if anybody has more questions, if they want to reach out to your office, what should they do first?
Well, there is a number. It is 615-329-5144, 615-329-5144.
And then there's also a number that may be easier for some to remember, and that is the Ascension St. Thomas Women's Heart Health Line, which is 615-284-4HER.
Yes, it is for her.
If you're going to your primary care doctor and the doctor says this could be heart related or something close to that, then the patient, they can always say, hey, look, I would like to go to Ascension St. Thomas. Can you send me there, or can you book me an appointment there? As a patient, you got to kind of push for what you want.
That's true.
Well, thank you very much for joining us this morning.
Thank you.
And I'm sure we'll talk to you again in the near future.
Talk to you soon, Scott. Be safe and stay warm.
With us this morning, Dr. Nishtha Sareen. And once more, she is with Ascension St. Thomas Heart right here in Rutherford County, and she serves as the medical director of the Women's Clinic at Ascension St. Thomas Heart.
Thank you for calling.